Hi, this is Dr. Lewerenz at Longevity Health Institute. Thought I'd share with you some recent data and new discoveries on vitamin D. Vitamin D is amazingly treated and used in our body and in health and wellness as a hormone. And so that's a pretty profound statement and pretty significant because one of the strongest things in your body is a hormone, and our hormones. Not necessarily the most important, because what's most important is what's off, what's wrong, whether it's digestive, whether it's neurodegenerative, like brain function, heart function, what have you, your diet, your weight, etc. But what's interesting is that at a chemical level, at a biochemical level, at a molecular level, organically, vitamin D looks just like a hormone. And that's how it impacts our body, that significantly. There's a multitude of studies on vitamin D, the benefits of your immunity and bone health, and recovery, and mood and energy, and less cardiovascular disease, and less depression, and improving the elderly with balance, and longevity, and falls, and things like this. But there's an interesting study that just came out, and I think it speaks for itself. When they looked at geography, the closer to the equator you were, and then extrapolating out from the equator, the more degenerative disease, immune issues, and specifically cancer got worse. Essentially, if you were by the equator and had higher vitamin D levels, you would have less cancer and a better immune system. And as the data showed that geographically, as you got further away from that, and here we live in the Midwest, in Michigan here, and maybe this will find you somewhere warmer or somewhere closer and better climate, year-round at least, you might have a better vitamin D. The point here is though getting more optimal and quality vitamin D is essential to your wellness and to your health, okay? We want levels to be about 60 to 80 to be more optimal. We test once or twice a year at least. Most people, I average my patients that are in the Midwest, most of them require about 5 to 10,000 IUs a day because of an absorption issue. They're fat-soluble vitamins. They take a little bit more effort and more dosing to absorb. Obviously, this is in a medical setting and retested later and not just done blindly. There is toxicity to vitamin D, albeit difficult to get to. But it is a fat-soluble vitamin, so it does store in your body, and you don't take the same dose indefinitely. Different than water-soluble vitamins like the B's and C and etc., magnesium, things like that. But getting optimal vitamin D can make a huge improvement in bone health, in energy, in mood enhancement, in immunity, fighting infections, less cancer, like I said in that study, that geographic study. So do yourself a favor, make sure you get your vitamin D checked. Make sure you get a level in your shooting for a level that's more optimal around the 60 to 80 range. Bone health starts in the 30s, 20s and teens. We see all the time, sometimes single digits. That is not acceptable, okay? So do yourself some good and get some vitamin D. Better yet, get some sun. This is Dr. Lewerenz at Longevity Health Institute. Be well.